Hi everybody, today I'm going to post a very important video, and that is regarding females, especially young girls, which come with this one of the most common problems, and that is dysmenorrhea. I have seen so many young girls suffering from this problem in my clinic, and today I'm going to make a video about this, okay? And so many young girls and adult females also suffer from this problem, so I thought to make a video. So please listen to and watch this video very carefully, because here I'm going to discuss the causes, risk factors, complications, and treatment of dysmenorrhea. Okay, so let's start the video. Well, menstrual cramps, which is known as dysmenorrhea, or throbbing or cramping pains in the lower abdomen. Many women have menstrual cramps just before and during their menstrual periods. For some women, the discomfort is merely annoying. For others, menstrual cramps can be severe enough to interfere with everyday activities for a few days every month. Conditions such as endometriosis or uterine fibroids can cause menstrual cramps. Treating the cause is the key to reduce the pain. Menstrual cramps that are not caused by another condition tend to lessen with age and often improve after giving birth. Now let me tell you the symptoms. Symptoms of menstrual cramps include throbbing or cramping pain in your lower abdomen that can be intense, pain that starts 1 to 3 days before your period, peaks 24 hours after the onset of your period, and subsides in 2 to 3 days, dull continuous ache, pain that radiates to your lower back and thighs. So these are the symptoms, and some women also have nausea, loose stools, headache, and dizziness. You should see your doctor if menstrual cramps disrupt your life every month, your symptoms progressively worsen, or you just started having severe menstrual cramps after the age of 25. Now let me tell you the causes of dysmenorrhea. During your menstrual period, your uterus contracts to help expel its lining. Hormone-like substances, which are known as prostaglandin, involved in pain and inflammation, trigger the uterine muscle contractions. So higher levels of prostaglandins are associated with more severe menstrual cramps. Menstrual cramps can be caused by endometriosis. Now I'm going to tell other conditions which are associated with increased muscular cramps or dysmenorrhea. So the first condition is endometriosis. The tissue that lines your uterus becomes implanted outside your uterus, most commonly on your fallopian tubes, ovaries, or the tissues lining your pelvis. The second most common condition, which is presented to us, is uterine fibroids. These non-cancerous growths in the wall of the uterus can cause pain. And another condition similar to this is adenomyosis. This is in this, the tissue that lines your uterus begins to grow into the muscular walls of the uterus. Then if some ladies suffer from pelvic inflammatory disease, that can also cause dysmenorrhea. This is the infection of the female reproductive organ, which is usually caused by sexually transmitted bacteria. Then there is a condition that is known as cervical stenosis. In some women, the opening of the cervix is small enough to impede menstrual flow, causing a painful increase of pressure within the uterus. Now let me tell you the risk factors. You might be at risk of menstrual cramps if you are younger than age 30, you started puberty early at age 11 or younger, you bleed heavily during periods, that is known as menorrhagia. In the coming days on my channel, I'll post a video about menorrhagia also, inshallah. Another risk factor is menorrhagia, that is if you have irregular menstrual bleeding, and I'll post a video in the coming days on this topic as well, inshallah. And if there is a family history of menstrual cramp, then there is a likely chance that you may also suffer. So like for example, if your mother, if your sister is suffering from this problem, then there is a likely chance that you may also suffer. So this is another risk factor, family history. And also if some ladies they smoke cigarettes, so there is an increased chance of dysmenorrhea in the smokers. Okay. Now let me tell you the complication. Menstrual cramps do not cause other medical complications, but they can interfere with school, work, and social activities. Certain conditions associated with menstrual cramps, which I have told you, can have complications though. For example, endometriosis can cause fertility problems. Pelvic inflammatory disease can scar your fallopian tube, increasing the risk of a fertilized egg implanting outside of your uterus, that is known as ectopic pregnancy. So these are the complications. Now let me tell you the diagnosis of menstrual cramps, that is dysmenorrhea. I have seen so many young girls coming with this problem. So we usually review your medical history and perform a physical exam, including a pelvic exam. During the pelvic exam, we'll check for abnormalities in your reproductive organ and look for signs of infection. If we suspect that a disorder is causing your menstrual cramps, I mean the condition associated with increased menstrual cramps, which I just told, if we suspect these, then we can order for certain tests such as ultrasound. This test uses sound waves to create an image of your uterus, cervix, fallopian tubes, and ovaries. Other imaging tests we can order, for example, a CT scan or MRI scan provides more detail than an ultrasound and can help us to diagnose underlying conditions. CT combines X-ray images taken from many angles to produce cross-sectional images of bones, organs, and other soft tissues inside your body. MRI uses radio waves and a powerful magnetic field to produce detailed images of internal structures. Both tests are non-invasive and painless. Then also in some cases we may order for a laparoscopy. It is although not usually necessary to diagnose menstrual cramps. Laparoscopy can help detect an underlying condition such as endometriosis, adhesions, fibroids, ovarian cyst, and ectopic pregnancy. During this outpatient surgery, your doctor reviews your abdominal cavity and reproductive organ by making a tiny incision in your abdomen and inserting a fiber optic tube with a small camera lens. So these were the diagnostic tests regarding dysmenorrhea. Now let me tell you the treatment. To ease your menstrual cramps, we might recommend pain relievers, over-the-counter pain relievers such as ibuprofen and or naproxen sodium at regular doses starting the day before you expect your period to begin can help control the pain of cramps. Prescription non-steroidal anti-inflammatory drugs also are available. Start taking the pain reliever at the beginning of your period or as soon as you feel symptoms, and continue taking the medicine as directed for 2 to 3 days or until your symptoms are gone. Then there is another option we may prescribe, that is hormone birth control. Oral birth control pills contain hormones that prevent ovulation and reduce the severity of menstrual cramps. These hormones can also be delivered in several other forms, such as an injection, a skin patch, an implant placed under the skin of your arm, a flexible ring that you insert into your vagina, or an intrauterine device. In some cases, if there are associated conditions, surgery may be required if your menstrual cramps are caused by disorders such as endometriosis or fibroids. Surgery to correct the problem might help your symptoms. Surgical removal of the uterus also might be an option if other approaches fail to ease your symptom and if you are not planning to have children. Now, I should tell you about lifestyle and home remedies. Please pay attention to this also. Besides getting enough sleep and rest, things you might want to try include exercise regularly. Physical activity including sex helps ease menstrual cramps for some women. Use heat. Soaking in a hot bath or using a heating pad, hot water bottle or heat patch on your lower abdomen might ease menstrual cramps. You can also try dietary supplements. A number of studies have indicated that vitamin E, omega-3 fatty acids, vitamin B1, and vitamin B6 and magnesium supplements might reduce menstrual cramps. Also, you should reduce your stress. Psychological stress might increase your risk of menstrual cramps and their severity. Well, on my channel with BP, I have posted some stress relieving videos also. Especially if you check my playlist of music therapy, there are some very ambient and soothing music that can also reduce your stress. Okay. Now I shall tell you a little bit about alternative medicine. Most alternative therapies for treating menstrual cramps have not been studied enough for experts to recommend them. However, some alternative treatments might help, including acupuncture. Acupuncture involves inserting extremely thin needles through your skin at strategic points on your body. Some studies have found that acupuncture helps relieve menstrual cramps. Then there is another technique which is known as transcutaneous electrical nerve stimulation, that is TENS in short form. A TENS device connects to the skin using adhesive patches with electrodes in them. The electrodes deliver a varying level of electrical current to stimulate nerves. TENS might work by raising the threshold for pain signal and stimulating the release of your body's natural painkillers, which are endorphins. In studies, TENS was more effective than a placebo in relieving menstrual cramp pain. The herbal medicines. Some herbal products such as pycnogenol, fennel, or combination products might provide some relief from menstrual cramps. Acupressure, like acupuncture, Acupressure also involves stimulating certain points on the body, but with gentle pressure on the skin instead of needles. Although research on acupressure and menstrual cramps is limited, it appears that acupressure may be more effective than a placebo in easing menstrual cramps. So this was my video about dysmenorrhea or menstrual cramps. So I hope you like this video. There are being a physician, general physician, I am seeing almost all kinds of cases related to gynecology, medicine, surgery, pediatrics also. So please, if you haven't subscribed my channel Obed BP, it's time to subscribe now and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my video provides some sort of benefit, even it is a little bit benefit, please do not forget to give a thumbs up to this video and other videos also. And also please share these videos through social media such as Facebook and Twitter, so that other people can also get benefit from my health related videos. Thank you so much for watching this video. See you in next video. Bye for now.